Now, this part. Good afternoon, everybody. This afternoon, we are going to discuss infection control. And then let's look at the introduction of infection control. Infection control plays a vital role in midwifery practice to prevent transmission of infectious diseases and ensure the safety of both patients and healthcare providers. Proper infection control measures promote a clean and hygienic environment, reduce the risk of healthcare associated infections, and improve patient outcomes. Let's look at some key terms that we shall be meeting in some of the slides. The first term is asepsis. Asepsis means absence of illness producing microorganisms. Second term is known as medical asepsis. Medical asepsis means the use of precise practice to reduce the number, growth, and spread of microorganisms. In the brackets, it can also mean a clean technique. And medical asepsis includes hand hygiene, wearing gloves, that is latex, wearing gloves, although some of the individuals, when they put on gloves, they may develop allergy, which is known as latex allergies. Isolation precautions, these are also included under medical asepsis. Surgical asepsis, surgical asepsis precisely refers to practices that reduce all microorganisms. In brackets, it's a sterile technique. Sterile gloves are used and the sterile equipment are used. Therefore, no microorganisms should be present on them. Surgical asepsis mostly is used in theatre when they are carrying out operation on a patient. All the linen, all the equipment that is utilized on the client should be sterile, meaning there should be no microorganisms on them. Let's look at the key principles of infection control. One of the principles is universal precautions, hand hygiene, personal protective equipment, that is PEP. Let's discuss the universal precautions in details. Universal precautions are infection control measures designed to prevent transmission of bloodborne pathogens and other infectious agents. Universal precautions are an approach to infection control that assumes all blood and body fluids are potentially infectious. As a health worker or as health workers or students, we should not take for granted blood or body fluids coming from an individual because these are mostly infectious because they could be carrying some microorganisms. Healthcare workers must follow standard precautions which include hand hygiene, the use of protective personal equipment, that is PEP, safe injection practices, and respiratory hygiene. Let's look at hand hygiene. Hand hygiene is a simple practice. It's a simple practice and it's one of the simplest methods that we can use to prevent the spread of microorganisms. Hand hygiene involves washing hands with soap and water or using alcohol-based hand sanitizers before and after every patient care. Below is a diagram which shows the techniques a health worker is going to utilize while he or she is washing their hands. Remember, it's vital to follow these techniques because when you use these techniques, your hands will be rendered clean. Do not assume and wash your hands using the usual way that we use, the usual method that we use when we are washing our hands with the soap and water at home. So it is quite important that you follow these techniques when you are washing your hands. These techniques also involve movements, movements of hand hygiene before touching a patient, before a procedure, after touching a patient, after touching a patient's surroundings, after the procedure or body fluid or exposure of a risk, hands must be washed. And when you are washing the hands, remember to follow the hand washing techniques. Let's look at the personal protective equipment, that is PEP. Personal protective equipment includes gloves, masks, gowns, and eye protection. Healthcare workers should wear appropriate personal protective equipment based on the anticipated exposure to the body, based on the anticipated exposure to blood, body fluids, and secretions. For example, if you are going to assist if you are going to assist in the operation of a cesarean section, it is important that you wear on the goggles. It is important that you wear on the eye protection. It's important that you wear the eye protection gears because this will prevent you from any fluid that may splash into your eyes. Let's look at the respiratory hygiene and cough etiquette. Encourage patients or visitors to cover their mouth and the nose while coughing or when sneezing. Provide tissue, masks, and hand hygiene facilities in waiting areas, mostly in the hospital, in the primary health care centers, and units. If somebody is coughing, he or she should fold the arm, then cough into the bend of the elbow as depicted in the diagram. Let's look at safe handling of sharps. Safe handling of sharps. Use aseptic techniques during all invasive procedures, including injections, to prevent transmission of infections. Follow proper hand washing, follow proper hand hygiene, use sterile needles and syringes, and dispose of the sharps safely into a safety box. Sharps such as needles, scalpels, these usually pose a risk of injury and infection transmission. That's why immediately after carrying out a procedure, dispose the sharps, whether they are needles or scalpels, dispose them into a safety box. Use safety engineered devices to minimize the risk of hand stick and injuries. When it comes to needles, do not recap the needle because in the process of recapping it, it can easily injure the health worker. So disposal of sharps should be into a puncture-resistant container immediately after use. It can be a safety box, which is the most common example. Let's look at safe handling and disposal of waste. Proper segregation, containment, and disposal of healthcare waste are crucial to prevent the spread of infections. Follow guidelines and regulations of waste management and ensure appropriate labeling and disposal methods. Below is a diagram which is depicting waste segregation, that is segregation of solid biomedical waste, non-infected waste, which could include cytotoxic drugs and chemical waste. This should be disposed of in a black plastic container, and this container should have a cover. Then we have solid waste, for example, infected dressings or plaster of Paris casts. These should be disposed of into a red plastic container. Then we have infected waste. This could be anatomical waste, placenta, pathology waste, and body parts. This should be disposed of into a yellow plastic container with a cover. Then we have infected plastics. This could be syringes, gloves, and plastic waste. This should be disposed of into a blue plastic container. Then we have the sharps, needles, and the cuts and the glasses. These are disposed of into a white plastic container. Then by the end of the day, all these containers should be taken to the common treatment facility where they will be treated accordingly. Let's continue with the safe handling of medical waste. Medical waste includes blood, body fluids, or potentially infectious materials. Therefore, proper handling of medical waste is important to prevent the spread of infections and protect healthcare providers, patients, and also the environment. Let's continue with the active protection of environment in waste management. Healthcare facilities should implement proper waste management practices to protect their environment, and this includes segregation, recycling, and appropriate treatment of medical waste. Let's look at waste management hierarchy. The waste management hierarchy emphasizes reducing, reusing, and recycling waste as preferred strategies over disposal. So healthcare facilities should strive to minimize waste generalization and maximize economically friendly practices. Let's look at the types of medical waste. Medical waste can be categorized into different types. The first type is sharp waste. The sharp waste includes needles, syringes, lancets, scalpels, and other sharp objects. The sharp waste should be disposed of into a puncture-resistant container labeled sharp waste. The other category is pathological waste, which refers to tissue, organ, or body parts. These ones are normally removed during a surgery or autopsy, so they should be properly sealed and labeled for appropriate disposal. Let's continue with the types of medical waste. We have infectious waste. Infectious waste consists of contaminated blood or other potentially infectious material. Infectious waste should be segregated, double bagged, and also labeled for appropriate disposal. Then we have pharmaceutical waste. This includes expired or unused medications and other pharmaceutical products. Proper disposal methods should be followed to prevent accidental ingestion or environmental contamination. It's important that pharmaceutical waste are disposed of in the right way so that children do not come across them and eat them up because they are dangerous. Number 5, we have chemical waste. Chemical waste is made of hazardous substances. These substances can include disinfectants, solvents, and laboratory chemicals. So chemical waste should be disposed of according to specific guidelines and regulations of the hospital or the clinic or the PHCC. Let's look at proper waste segregation. Healthcare facilities should have a system in place for proper waste segregation. Segregation ensures that different types of waste are appropriately handled and disposed of. For example, the other previous slide that I showed you, which had different containers, and those different containers had different colors, and they were labeled for the various type of waste where they are supposed to be disposed of. Recycling and waste reduction. Recycling programs should be implemented to reduce waste generation and minimize environmental impact. Reusable items such as containers or packing should be encouraged whenever possible. Medical waste should undergo appropriate treatment methods such as incineration, which is done with the help of an incinerator, autoclaving or chemical treatment. You can see the incinerator in the diagram, it's a big one. You can also see the autoclave. So treatment should be performed following local regulations and also guidelines. Let's look at promoting sustainability in waste management. Healthcare facilities should strive to adopt sustainable waste management practices. This includes reducing waste generation, implementing recycling programs, and exploring environmental friendly treatment methods. For example, the use of the autoclaves. Let's look at the principles of isolation and barrier nursing. Isolation refers to separating individuals with contagious diseases to prevent the spread of infection. Barrier care involves the use of protective barriers such as gloves, masks, gowns, and goggles to reduce the risk of infection. Let's move on to the types of isolation. Different isolation precautions may be used based on the mode of transmission of the infectious agent. For example, we have close contact isolation, droplet isolation, airborne isolation, and protective isolation. Let's look at the different types of isolation. Say the different isolation precautions may be utilized based on the mode of transmission of the infectious agent. For example, we have contact isolation. For example, in COVID-19 pandemic, the contacts who were found to be having COVID, some of them were isolated. Droplet isolation, airborne isolation, and other protective isolation. Environmental cleaning. Regular cleaning and the disinfection of surfaces is important, especially in the hospital or in the primary health care centers or units. Equipment should be cleaned and the patient care areas should also be cleaned to prevent transmission of infections. Patient care areas include the examination couch, the beds which the patients lie on, and the bed sheets also have also to be washed. Environmental cleaning should follow established protocols and use appropriate disinfectants. Isolation procedures. Isolation procedures are implemented to prevent transmission of infectious agents among patients and also health workers. The isolation procedures include contact precautions, droplet precautions, airborne precautions, and protective isolation. Contact precautions. Contact precautions are used for patients with a known or suspected infection that can be transmitted via direct contact, for example, COVID-19, Ebola. So, contact precaution involves wearing of gloves, gowns, and following of strict hand hygiene practices to prevent spread of infection from the patient to the health worker. Droplet precautions. These are procedures that are used for patients or clients with the infections spread by droplets generated from activities like coughing, sneezing, or talking. Healthcare workers should wear masks and follow respiratory hygiene procedures. Airborne precautions. Airborne precautions are used for diseases that are transmitted through small airborne particles. Special respiratory protections such as N95 masks and negative pressure rooms are necessary. Protective isolation is implemented for patients with a compromised immune system, such as patients who have undergone transplant recipients or individuals undergoing chemotherapy. The aim is to protect the patient from acquiring infections and may also involve strict adherence to hand hygiene and also restriction of visitors. Because if so many visitors are allowed in, chances are these visitors will also be having infections that they will transmit to our patient. Yet our patient is not supposed to be infected because his immune system is low. Let's move on to monitoring and auditing. Regular monitoring and auditing of waste management procedures helps to identify areas for improvement and ensure compliance with the regulations. Monitoring and auditing also helps to maintain accountability and adherence to proper procedures of waste management. Collaboration and communication. Effective collaboration and communication among health workers, waste management staff and the environmental agencies is essential for proper waste disposal and also protection. Clear guidelines and channels of communication should be established. What do we mean by this? For example, if you're working in a hospital, there should be a team of staff who are responsible for the waste management, for waste management. So the particular staff are to ensure that the various disposal items are available such that the waste should be disposed of in the right way, and also the staff have to follow up. They have to communicate with their fellow staff, reminding them that the waste should be disposed of in the right way, because human errors at times occur whereby somebody is very tired, then they dispose of the waste to the wrong container. So the waste management staff must ensure that they keep communicating to the other staff on the importance of disposing the waste into the right containers. Let's look at the impact of inadequate waste management. Improper waste management can harm the public health, the environment, and the local communities. Improper waste management can contribute to spread of infectious disease and pose risks to the wildlife, water, animals, and also ecosystem. For example, if gloves have not been disposed of in the right way, you may find that the small children will get the gloves and use and start blowing them as balloons, yet these gloves have already been contaminated, hence spreading infection to the young children. And also, if waste is not managed very well and it is disposed of into the water sources, you will find out that it is also going to destroy some of the aquatic, some of the animals that stay in there, some of the aquatic animals, especially the fish, will also be destroyed. Not only that, the water will also be contaminated, and remember, human beings consume that water, animals also consume that water, so it will be a hazard to both humans and also animals. Environmental regulations and compliance. Healthcare facilities must adhere to the local, regional, and national regulations governing the safe handling and disposal of waste and disposal of medical waste. Compliance ensures that waste management practices are aligned with the environmental protection standards. So what do we mean here? It means that all healthcare providers and facilities must ensure that medical waste are disposed of into the right way and they should follow the guidelines. Training and education. Ongoing training and education for healthcare workers and waste management staff are essential for effective waste management. As I already told you, that remember at times some of the health workers are too busy and they may forget to dispose of the medical waste in the right containers. So there should be ongoing training, ongoing reminders by the staff management team reminding their fellow health workers to dispose of the medical waste into the right place. So training programs should cover waste segregation, handling techniques, and the environmental considerations. Let's look at infection prevention and control committees. Healthcare facilities should establish infection prevention and control committees to oversee waste management practices. These committees can develop policies, conduct audits, and ensure compliance with infection control and waste management guidelines. For example, one of the hospitals where I worked at a certain time, that hospital used to have a waste management committee, and every month they were doing audits to see and find out which ward managed their waste in the proper way and which ward followed the procedures of waste management. So among all the departments that were there, for example, medical, surgical, labor ward, if any of those departments managed their waste very well, they were given an award for that. Let's look at public awareness and engagement. Engaging the public and raising awareness about the importance of proper waste disposal and its impact on health and the environment is very crucial. So public education campaigns should be done to encourage responsible waste management practices at home, in the health at home and also in the healthcare settings. At home, if waste is not managed also in the right way, it can also lead to the spread of diseases. For example, human excreta should be disposed of into a latrine. If the village does not have latrines, then it means that the waste will not be disposed of into the latrines, it will be disposed of into the surroundings. Then flies will sit on the excreta. If food is not covered very well, flies will sit on the food, then microorganisms will be transferred to the food by the flies. Then when the humans eat the food, they get sick. They will suffer from some of the diarrheal diseases as a result of poor waste management. So even in our homes, the waste should be managed very well. Whether it is human excreta, whether it is waste from the house, it must be managed very well to prevent spread of diseases. Let's look at technology and innovations. Technological advancement can aid in waste management, such as improved waste tracking systems, automated segregation processes, and also advanced treatment methods. Like nowadays, there are some trucks that are responsible for carrying away the waste from the market, and there are also trucks that are responsible for emptying the waste from the sewage systems. Then this waste is supposed to be treated before it is disposed of. So embracing innovative solutions can enhance efficiency and environmental sustainability. Let's look at the international guidelines and best practices. Several organizations, for example, the World Health Organization and the World Health Assembly, these provide guidelines and best practices for waste management in healthcare settings. So, these resources or these guidelines serve as a valuable reference for developing effective waste management strategies. What do we mean? We mean that the health workers should revisit these guidelines, they should read through them so that it will be able to help them help people wherever they stay, such that waste is managed in an effective way, such that diseases are spread of diseases is prevented. Let's continue with the education and the treating. Healthcare workers should receive education and training on universal precautions, waste management, and infection control practices. Ongoing training ensures compliance with the protocols and also enhances carefulness such that health workers will not acquire diseases, and also the caretakers of the patients. Let's look at cleaning and disinfection. Regular cleaning and disinfection of patient care areas, the surfaces, the beds, examination coaches, and the equipment. This is essential to maintain a clean and safe environment. Use of appropriate disinfectant and the following of recommended protocols for effective decontamination. Additional precautions may be necessary for specific infections or conditions such as tuberculosis, multi-drug resistant organisms, and airborne diseases. Follow specific guidelines for prevention and control of the diseases. In summary, we have looked at infection prevention. We looked at the introduction to infection prevention. We also defined the key terms. We also looked at the universal precautions like hand hygiene, the bed, handling of sharps, handling safe disposal and safe handling and disposal of waste segregation. We also looked at the types of medical waste. We also looked at the principles of isolation and barrier care. We looked at the types of isolation, the impact of inadequate waste management. Then we also looked at training and education for effective waste management. Have a nice evening.